Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a gastroenterology nurse practitioner for the past 6 years, and before that, I worked as a nurse in the endoscopy department for 15 years. I love gastroenterology and GI health, and that is why we're making these videos. Today, we are going to be discussing gastroesophageal reflux disease. It's a big word. Some people call it GERD. I don't really like that term. It sounds funny. Some people just call it reflux, heartburn, indigestion, sour stomach, all types of different terms. So what is reflux disease? That is actually where your stomach contents, particularly the acid or the bile, comes up into the lower part of the esophagus. Some people, it can come up even higher, but you get symptoms from it, or most people do. There are some people who don't have a lot of symptoms. Most people do because you feel it. It's uncomfortable. Some of the different symptoms that you might have would be a significant burning sensation anywhere from, upper part of the stomach, right around the rib cage where it comes together, all the way up into the back of the throat. Some people will actually kind of burp up food into their mouth. Belching is a symptom. People can have significant pain, not just a burning discomfort, but you can actually have pain. Some people will feel the burning or the discomfort even radiate through to the back at times. Some people will develop more significant symptoms because they've actually had reflux for a long time. That can include pain when you're swallowing. Some people will actually get food hung up in their chest and they can't get it down, or it takes a long time for it to get down. Every once in a while, people will find that at nighttime, if they're having reflux, they will wake up having a hard time catching their breath. Some people will get a chronic cough. Sometimes people will actually say, I wake up and I have acid coming out my nose or my mouth. And those are pretty significant symptoms. Sometimes this is because we have the sphincter between the esophagus and the stomach, and it usually stays tight. But sometimes it's really lax, and that's where stuff is coming back up. And there's different causes for that. Sometimes it's just not tight. Other times a hiatal hernia. But at any rate, reflux is a pretty common thing in America. If you go to your pharmacy, any grocery store, they have an entire aisle dedicated to treating reflux and heartburn, a lot of antacids. There are some things you can do besides just run into the store and start taking medications, though. Some basic ways to really help reduce the symptoms. One, try not to lie down within 2 to 3 hours of eating or drinking. This is one of the biggest things I tell my patients, and actually most of them will admit that makes a big difference. It helps you not have symptoms overnight because the food has time to digest and get out of your stomach, so it's not coming back up while you're lying down. And then they feel better in the morning. It'll help you feel like you're not nauseated or having some discomfort when you wake up. If you like to eat quickly, as most medical professionals do, try not to do that. Take your time eating smaller, frequent meals. You don't want to scarf it down, but take your time. Smaller meals, a larger meal, it sits in the stomach longer and it comes up faster. So smaller meals definitely are easier to digest to reduce the symptoms. Spicy foods, greasy foods, acidic foods, caffeine and alcohol are the big ones that cause symptoms. I'm not telling you to cut all of it out. That would be awful. I will never give up my coffee. However, moderation is the key. If you find that you're drinking 5 cups of coffee a day, you might want to cut that back to maybe 1 or 2 at the most. Smoking is not something that I could say moderation is acceptable. That one you want to cut out. Smoking absolutely makes symptoms worse, and it also increases your risk of esophageal cancer. So that is something, if you're a smoker, you're really going to want to try to stop. That's important. Overweight, not just general overweight, but especially in the abdominal area, that puts a lot of pressure on your stomach contents. So trying to get some of the weight off, focusing on lower carbohydrate diet can help with that and reduce your symptoms. If you find that overnight you definitely still feel like your reflux, even if you follow all the rules and you're not eating a lot right before bed and you still have some discomfort, you can elevate the head of your bed a little bit. I don't really recommend using a bunch of pillows because then you tend to slunch down as you're sleeping as the night goes on, but maybe consider a wedge pillow or even putting some blocks underneath the head of the bed to just give you a little bit of an angle. And that can really help. There are medications, a lot of over-the-counter medications that work for fast relief. Tums and Rolaids have been around forever. They work for a little bit of mild indigestion. not a lot of side effects from that unless you overdo it. Calcium can definitely lead to constipation. So if you tend to take 20 Tums a day, you might want to cut back on that. Actually, if you take Tums every day, we need to talk about that. You really shouldn't have to do that every day. Some of the other medications, histamine 2 blockers or H2 blockers, are Pepcid and Tagamet or Zantac. Those are also great for both fast acting, usually within 15 minutes you feel better, but they also tend to last about 12 hours of relief. And then some of the newer medications, which have still been around for 20 years now, are the proton pump inhibitors. Those are the ones you see: Prilosec, Nexium, Protonix, Dexilant. Those work on the cellular level. And those are not fast acting. Those are the types of medicines that you need to take at least once a day. And then they're going to build up in your system over time and help reduce the stomach acid and help prevent the symptoms of chronic reflux. When do you need to see somebody because you think maybe your reflux is out of control? Well, if you are finding that you have symptoms of reflux at least 3 to 4 days a week, you really should see somebody. Occasional reflux, like once every 2 weeks, that's all right. We all eat something that we know triggers it or sets it off, and you deal with it. But if you're finding that you're consistently having reflux disease, either after eating or when you're waking up or overnight, you want to see somebody. See your primary care provider, see a nurse practitioner, see a gastroenterologist. They can help you. Sometimes you just need a short course of medication. Sometimes there's something else underlying. And your gastroenterologist may want to do what's called an upper endoscopy, where you're sedated, at least we sedate for it. And they'll take a tiny little scope with a light on the end, and they can pass it from the mouth down the esophagus and into the stomach, even the upper portion of the small intestine, looking for the significant acid damage to the esophagus, or even, do you have a hiatal hernia? Especially people who are having any trouble with swallowing. If you are somebody who you notice, every once in a while I used to feel like maybe a peanut butter and jelly sandwich was slow to go down, but now almost every time I feel like chicken or beef or breads get hung up right here, or they even get stuck and it's painful, you want to see somebody about that. That could be because the acid is really causing a lot of damage in the esophagus, or you could be developing a narrowing or a stricture in the bottom of the esophagus. That is something that your gastroenterologist can help with. We can actually stretch that area open if you need it. But definitely, these are the things that you want to seek some help for. Don't try to manage it on your own. So that's really what I have for today. Please subscribe, leave me some comments. Let me know some other stuff that you would like to hear about or discuss. That's why I'm here. I would like for you to be informed and educated and know you're not alone. Thanks for joining me.